This is the Birth, Baby, and Life podcast with Kristen Burgess, and we're talking about how to say no, or at least wait, in episode number 215. Hi ladies, it is Kristen, and today we are going to talk about how to say no to medical interventions during birth, which is a topic that I am really excited to present. If you don't know me, my name is Kristen, and I am a pregnancy coach. I work with mamas all over the world, helping them to have an enjoyable pregnancy, grow a really healthy baby, and have a beautiful birth experience. I also work with mamas who are trying to calm the chaos so that they can really enjoy their children, have a happy home, and happy, healthy kids. So with that, let's jump into the topic today. We are going to dig into something that I think a lot of moms have trouble with, which is being able to say no to medical interventions that you don't want. Now, I'm going to say that I'm going to talk through some practical tips and how-tos from this, but I'm also going to link to a previous podcast episode where I interviewed Hannah, and I think that you should definitely listen to that episode because just listening to her tone of voice as she kind of role plays, so to speak, how she talked to her doctors and care providers and advocated for herself is just excellent. It's just so wonderful. So I'll probably mention that again, but I'm definitely putting that in the show notes. It's an older episode, but you are not going to want to miss it if this is something that you feel like you could use help with. So when we are looking at the topic of pregnancy and birth and medical interventions, I want you to realize that you have the right to decline any medical procedure. That includes testing, that includes routine standard procedures, and that also includes interventions, even interventions that could be considered quote unquote life-saving. Now, of course, there's going to be some instances where you want to take life-saving interventions, but a lot of times what happens in the pregnancy and birth world is you're told something needs to happen because it's a life-saving intervention, and then at the end, it didn't seem to be such a thing, and you end up feeling like you kind of got railroaded into something that you didn't want. So it's important to understand that you can say that you don't want to have interventions, to understand interventions and complications, and then understand how to advocate for yourself. And advocating for yourself is what we're going over in this podcast episode. So birthing women are adult humans, and they have the right to make decisions. That includes you. And then autonomy, respect, dignity, informed decision-making. You could say shared decision-making. All of these things are really important for you to feel and to experience as a pregnant mom who's making decisions for her care. So let's talk about a little bit of terminology. I feel like we've been doing a lot of terminology talking lately, but it's really important, especially when you're dealing with the medical world. So informed consent, and I'm going to read this definition, which I got I think I found this on the Cleveland Clinic website, but it's a really good definition. So it says, informed consent is one of the 9 core principles of the American Medical Association's Code of Medical Ethics. Opinion 2.1.1 in the Code of Medical Ethics states, informed consent to medical treatment is fundamental in both ethics and law. Patients have the right to receive information and ask questions about recommended treatment so they can make well-considered decisions about care. Now that came from the American Medical Association, but that kind of language, that codification of a woman's rights or a patient's rights in medical care, but we're looking specifically about a woman's rights in pregnancy and birth, is pretty universal across most nations. So even though I just read that, there's actually different codes and international codes and treaties and that kind of thing that talk about women's human rights in childbirth. But you'll see that human rights in childbirth is a consistent protected thing, protected body legal class for women worldwide in many nations. So it's not just limited to the U.S. And I thought that it was important that that Cleveland Clinic article that I found, which was just on informed consent, because I was looking for an official definition for y'all. But they actually gave childbirth procedures as an example of one of the things that's covered by this informed consent. I feel like as women, care providers often give you a schedule of testing and procedures and things that are going to happen. And they just kind of tell you what's going to happen. There's not really any discussion. There's not really any informed consent. There's not any expectation that you might say no to something. And so I don't feel like it's overt. So it's not like a provider saying, no, you can't disagree to this or anything. It's just that there's no cognizance in them at all that you might choose to decline this procedure. And I think there can be some condescension too, because they would think that any parent that chooses not to do this must be ignorant or misinformed or something. And you could say that there are some women who may decline things because they don't have information, but we need to give information. One of the things that I've been working on as I finish up the didactic portion of my midwifery studies is getting all of my practice resources together. And one of the things that I've been working on a lot lately is informed consent documents for various types of prenatal tests. And I hope, even though I'm not going to practice midwifery right now or even sit for my midwifery exams, I am actively pregnancy coaching. And my hope is if I've got a client who's going in for something, say the gestational diabetes test or the Group B strep swab or something like that, that I could provide her with the documents that I've created that give what I feel like is deep informed consent with a lot of information and extra resources if she wants to learn those. Now, when I was in my pregnancy, my midwife gave us informed consent documents, and I would guess that an obstetrician's office is going to give informed consent documents, but some of y'all can, you can let me know if you experienced this or not and how detailed did you feel like they got, because I think, again, most of the time, there's not really informed consent. It's interesting, as I shared a couple weeks ago, my sweetie's been going through some health issues, and I've been reading the records from some of the doctor's appointments that we've been to, and it was interesting to me that in one of the records that I read, it said, we discussed this, and this, and I was at that appointment, and those points did not get discussed. I did ask him, double check, did they talk about this and I just missed it? And he was like, no, they didn't say anything about that. So it's like, how often does that happen? Does that probably happens? I mean, if that happens in this office, it's probably happening in obstetricians' offices. So how many times is it noted in the official medical record that these things were discussed, but they were never actually discussed? So I think, again, there's an assumption that I'm the expert, I've gone to school, or the American College of Obstetricians and Gynecologists has said in Bulletin ABC, DEFG, that this is what we need to do, and so this is what we need to do, and that women are just going to be okay with that. But the reality is you as a woman get to decide, and you may want to decide. You know what? My doctor went to school. I want to follow his recommendations, and that's fine. But you also have the right to say, you know what? I want to understand in a little more detail what each of these things is before I consent. So that's informed consent. Now, we cannot have informed consent without informed refusal. And this is another thing that I think is a big problem. I also think this is something that happens even with midwives, is we talk about, here are informed consent documents. These are your informed consent documents. Here's your informed consent papers. Do you want to sign your informed consent papers? But we never talk about informed refusal. So it's almost like we're going to give you the information and then you're going to sign off on it and say that, okay, you got informed consent. But again, there's not any expectation that there may be informed refusal, that you may choose not to have that done. So you cannot have informed consent without having informed refusal. So that is an important part of this, is if you can consent, you have the right to refuse. And it is equally valid. And it is your right. So also another thing to consider too, and this is especially true for your birthing time, consent is ongoing. Your consent can be withdrawn. Vaginal exams are a good example. You can consent to one vaginal exam and then decide you did not like that, you do not want that to happen again, and you do not consent to anymore. You can be in the middle of having a vaginal exam done with the nurse or the doctor's hand all up in your stuff, and you can say, I feel uncomfortable, stop, I withdraw my consent. And they must stop. So consent is an ongoing thing. Just because you've consented to something doesn't mean you have to continue. Now, I think I talked about this several weeks ago too, but if you were in the middle of something like a cesarean section, you're probably not going to withdraw your consent right then. So this is talking about within reason, but certainly revoking consent during a vaginal exam sounds completely reasonable to me. Or saying, you know what, I know I said I wanted to do this a minute ago, but hold the phone. I actually need a minute to think about it. And these sorts of situations are more likely to come up in birth, but I think you could end up railroaded into things even in pregnancy. So if there's something that they want you to do a test and you say, okay, this is a good example. A lot of women will feel uncomfortable with a test. They don't want to have it done. And then or an induction or something like that, they'll schedule it, and then they'll have second thoughts. Just because it's scheduled doesn't mean you have to go through with it. You can call and say, nope, I'm not going to do that. I actually know many women who have ended up calling in and saying, I won't be there for this induction. And again, this is all balanced. If you've got some sort of major health issue going on and the induction is medically required for yours and your baby's safety, that's one thing. But many inductions are just because, oh, well, you hit a magic number on the calendar, or, oh, I have a golf. Yeah, I'm taking my kid. This is funny because my kids and I went to Great Wolf Lodge a few weeks ago. I'm taking my kids to Great Wolf Lodge next week. I can't be there to deliver your baby. Let's induce. It's something as frivolous as that. And we would hope, that's not the reason, but sometimes it is. So you don't have to, even if you have something like that scheduled, you don't have to show up. You don't have to be there, because that is essentially withdrawing your consent, which is within your right. And then again, I want to make this absolutely clear. Again, and this is talking specifically about surgery, but it's true for really any procedure. Legal precedent, which if you don't know what that means, precedent means these things happened in the past. They were brought before a judge or a jury or whatever, usually before a judge. So they were brought before a judge, and the judge made this decision, and that sets legal precedent. So that means when we are ruling on a case in the future or a current present case, we are going to look at what legal precedent said as we make a decision. And this is based on a common law tradition, which is Great Britain. Many of the countries that were part of the Commonwealth or may still be part of the Commonwealth. The United States, we all have a common law tradition, and there's precedent, right? Case precedent. So case precedent, legal precedent says that forced non-consensual surgery is considered battery. So in other words, it is illegal. It is on the same level as assault and battery. So non-consensual surgery is an assault and battery against your person. And that includes in pregnancy and birth. And that includes things like vaginal exams or procedures that you don't want to have. Again, legal precedent says they can't do those things to you if you don't want them. So think about informed consent, informed refusal, and also think about the fact that you do have these rights as a pregnant and birthing woman. And it doesn't mean that you're going to say no to everything. It doesn't mean that you're going to be combative or a brat or whatever. But it does mean that you have the right to think through these things and make the right decisions for you and your baby. So this information is from Rixa Fries in a presentation that she did about informed consent and informed decision-making, informed refusal. And these are just some notes from her. She says, competent adults have the right to refuse surgery and other medical treatments. Those are from rulings dating back to 1891, and I'm assuming she's talking about the U.S. there. Informed consent does not exist without informed refusal. Again, non-consensual surgery is equal to battery. So surgery without the option to decline, this is another important point, surgery without the option to decline is non-consensual. So if you're told this is the only option, you cannot give consent because there has to be an ability to say no. And then not providing full informed consent, such as the risks of the procedure and alternatives, equals negligence. And she gives some case law that helps set this precedent. So Union Pacific Railway versus Botsford, Schollendorf versus the Society of New York Hospital, Cruzan versus Director of the Missouri Department of Health, Henry Brown, Cruzan versus Harmon. So those, Mater of Guardianship of LW, Enre Fiore, and Stouffer versus Reed. And again, if you want, I can try and actually put a shot of this slide, and I'll put a link to the presentation where Rix is talking about this. But those are just some bold statements that are true legal fact, at least in the U.S. And again, most nations around the world have similar legal protections in place, and also some case law. That's unique to the U.S., though occasionally other countries who have a common law tradition will pull for an example. But especially if you're in the U.S., all of that case law backs you up. So there is the White Ribbon Alliance is a group that I like. They talk about women's health care and women's rights and health care overall, but they have a respectful maternity care charter, and human rights in childbirth also has a stance on autonomy and consent. So I was going to just bring up some of what the White Ribbon Alliance says. Let me see if I can just find this page here. So these are the universal rights of women and newborns, and I will link to a PDF that explains all of this in detail. I'm just going to read each of the rights right now, but there is actually a descriptive paragraph with each of these. So everyone has the right to freedom from harm and ill treatment. Number 2, everyone has the right to information, informed consent, and respect for their choices and preferences, including a companion of choice during maternity care and refusal of medical procedures. So that means that if you want somebody with you, you can have somebody with you, which is that's definitely a problem women encounter. Number 3, everyone has the right to privacy and confidentiality. Number 4, everyone is their own person from the moment of birth and has the right to be treated with dignity and respect, including pregnant moms, because often we're treated really patronizingly when we're pregnant. And then also the newborn has the right to be treated with dignity and respect, even if they need interventions or procedures. Number 5, everyone has the right to equality, freedom from discrimination. Everyone has the right to equality, freedom from discrimination, and equitable care. Number 6, everyone has the right to health care and to the highest attainable level of health. Number 7, everyone has the right to liberty, autonomy, self-determination, and freedom from arbitrary detention. Now, this point is in there particularly because in some countries, women who cannot pay the hospital will be detained in the hospital until they can pay, or the child will be kept. So that's why arbitrary detention is on that list. But truly, in every country, I think we need to really ponder liberty, autonomy, and self-determination. Those are your rights in pregnancy and birth. Number 8, every child has the right to be with their parents or guardians. I just had a mom in the Facebook group who had her baby a little early and felt like, she's in a first world country and is having to fight to be with her child and to be able to make choices for her child. So every child has the right to be with their parent and parent to be with their child. Number 9, every child has the right to an identity and nationality from birth. And number 10, everyone has the right to adequate nutrition and clean water. And I really feel like those points are so important for us to consider. And the reason I take the time to share so much about informed consent and to read from these bodies of knowledge and talk about case law and legal precedent and these kind of guidelines that are human rights documents that we have is because I want you to understand that all of this is yours. All of these are your rights. And it's good to understand that. Continuing that, again, this is something that Rixa pointed out, which I think is really good, but she is sharing from the ACOG, American College or Congress of Obstetricians and Gynecologists, and their committee opinion number 664, refusal of medically recommended treatment during pregnancy. A decisionally capable pregnant woman's decision to refuse recommended medical or surgical interventions should be respected. The use of coercion is not only ethically impermissible, but also medically inadvisable because of the realities of prognostic uncertainty and the limitations of medical knowledge. As such, it is never acceptable for obstetrician gynecologists to attempt to influence patients towards a clinical decision using coercion. For example, saying something like, your baby's probably going to die if we don't do this right now, would be considered coercion. That, in kind of the jargon that is used in many of the birth worker worlds, is waving the dead baby flag. And I feel like the dead baby flag gets waved a whole lot today when we talk about gender stuff too. But waving the dead baby flag to me is heinous. I mean, if a baby's life is really in danger, then you talk to that woman and you say calmly and honestly, you present the facts and the information, and women will understand the gravity of the situation and will consent to a life-saving procedure. But oftentimes the dead baby flag is used flippantly to bully women. And ACOG itself, again, that's American College of Obstetricians and Gynecologists, says that you cannot coerce a woman and that a woman gets to make her own decision. This is another time you'll really see that is when a woman is considering a VBAC. And there's a lot of flag waving going on that, oh, if you don't consent to a repeat cesarean, then XYZ is going to happen. When actually, and notice the language on that, medically inadvisable because of the realities of prognostic uncertainty. That means they cannot be certain of the prognosis, and also the limitations of medical knowledge. So that's a good statement because it's acknowledging that, yes, we think we know the problem, we're pretty sure, but there may be limitations, and especially with something like scheduling surgery for a repeat cesarean or something like that because you don't want the woman to try a VBAC. There may not even be a prognosis. There's just this is what I feel more comfortable with. And I believe it's important to find a care provider that's supportive of you, especially if you're in a situation like that, VBAC, or you're wanting to try a vaginal birth with twins or something like that, or a breech birth. You want to find a care provider who has a level of comfort with that situation and who has a skill set for that situation. But also you shouldn't be coerced into something just because you don't want to, just because they're comfortable with something else and you want to try something different. You should be able to decline and also seek a second opinion or go for a different provider or something. So all of that is just to set a foundation for you to know, okay, how do I say I don't want to do this? Or how do I build this foundation that helps me feel strong when I'm standing up and advocating for myself? So that's the foundation. Now, the next thing to do is to really understand what's going on. Like, understand common interventions, understand testing that happens, like prenatal testing, and because that's one thing that you will make decisions with, and it's good practice, I think, even if you're going to consent to every single prenatal test that's offered. This is a great opportunity to practice informed decision making because it gives you the opportunity to consider all the information that they present, the pros and the cons, and your informed decision making documentation should cover both the pros and the cons. If it shows no downsides, you probably need to talk to your provider about being a little more realistic, or ask them at least straight up, is there really no downside to doing this? Because even if the downside is something like possible heightened emotional distress while you wait on the test results, that's something that you need to know. Or even if it's like, this is a screening test, and if a positive screen could cause significant emotional distress while you wait for further diagnostic testing, and that's something that there's a difference between screening and diagnostic testing, which we can talk about in another podcast episode. So understanding that there might be mental distress or angst while you wait for the diagnostic testing to come back, that should be noted in the informed consent document, because you can't make an informed decision unless you have all the information. So pregnancy is a good time. Again, even if you're planning to go with every recommended test, pregnancy is a good time to talk with your care provider, to read over that information, to do additional research, talk to a pregnancy coach like me if you're working with one, talk to your doula if you're working with one, and then also dialogue with your care provider and ask to go over it. If this is your 6th pregnancy and you've made a lot of decisions, maybe not. But especially if this is your first pregnancy or a first pregnancy after kind of just going by the book previously, practice this dialogue with your care provider. Say, okay, well, this is what I'm reading. Can you talk to me? What are the pros? What are the cons? Because that's practicing advocating for yourself. One of the things I talked about in the last podcast episode where I shared my tips from pregnancy and birth, or my 8 pregnancies and births, was advocate for yourself. And this is a good opportunity to practice advocacy. And then that helps you when you get to your birthing time to advocate for yourself during your birthing time. Now, another thing, again, is don't just get their information. I think that you also need to look for outside information. This is the reason why I recommend that every mom take a birthing class, whether you take my mama baby birthing class or take another really in-depth prepared childbirth class. The hospital class is probably not going to cut it, ladies. But my mama baby birthing class is really in-depth. I go over every complication, every intervention in pregnancy and birth that you could see, that you could face, and talk about when do these things happen? What do we do to prevent? Remember, we've talked about the difference between screening and or early detection and prevention, and I'm actually decided I'm going to do a whole podcast episode on that. But also, you want to talk about prevention of complications, but also if there are interventions that are done, when are they needed? When are they warranted? If you have that knowledge, and again, a good prepared childbirth class like Mom and Baby Birthing is going to help you have that knowledge. and in a concise format so that you know that you're missing everything. Because another problem with moms is, oh, I'll just Google everything, but you don't know what you don't know. So that's one of the reasons why having a comprehensive resource is important, because your doctor's office might tell you a little bit, but you just don't know what you don't know. So having somebody who has put together a course because they're experienced in the birth world and they know all of this can be really, really, really helpful to you. So go through that comprehensive course and understand what happens in pregnancy and birth, both physiologically, the stages of labor and the mechanics of labor and birth and all of that, but also understand these interventions and that sort of thing, and why are they done? When are they warranted? When are they not warranted? Because that gives you the information that you need to be able to advocate for yourself during both pregnancy, but especially in birth, when things are probably clipping along, or maybe they're not moving along, but the tensions are high and you want to sift through everything. One thing that I think is really important, and this I hinted at this in the teaser at the beginning of the episode, when we're learning to say no or wait, is that asking for time can be a powerful strategy, especially in a hospital situation. So even in a high stress situation, you can take a few minutes to talk things over with your partner or your support person, or to think through things. Or I had one mom who was coaching with me, and we were like texting back and forth while she was at the hospital, because she found that the texting was discreet. She wasn't talking out loud for the staff to hear, but we were able to kind of go back and forth as she was advocating to have the birth experience that she wanted. And it didn't all turn out exactly as she wanted, but I think that in the end she had a really good experience, and my heart is just still touched by the picture that she sent me shortly after her son's birth. Just this radiance to her. It was wonderful. But, even taking a minute here or there to talk, to discuss, to consider, to pause is a really, really, really powerful tool, especially during your birthing time. Ask to wait. And if you're feeling pressured by staff, you can even say, you know what, we want a couple minutes to talk, and to talk alone. And they can go out and you guys can have a couple minutes to talk, or to call somebody if you want to talk to somebody else. In general, most things going on in birth are not emergencies where there has to be immediate action taken. There are a couple, something like a cord prolapse, or when a baby just completely, their heart rates just drop completely and they're not coming back up. Though even that, like if a baby's heart rate is dropping, if you look at like nursing school materials and the things that nurses use, like the mnemonics and things that they use to learn what to do in certain situations, like the very first thing if a baby's heart tones are low is usually to shift the mom's position. And often the baby's heart tones will come back up. It's just often that baby isn't happy with the position. But there could be a situation where baby is just not doing very well, and it's very obvious, and things need to move very quickly. But it's often muddied and made to seem like that situation when it's not. The other situation, of course, being a cord prolapse. And another one, maybe like a hemorrhage that a mother is having. I believe that with that one, as I mentioned a couple podcast episodes, that's an iatrogenic thing. Often it's caused by all the messing with that's done in the hospital of the hormonal flow and the mother and the baby and the separation and all this stuff that just nature did not intend to happen right after the moment of birth. And there's disagreement. There's major midwifery boards and things that recommend for active management of the third stage, which is, just being poised to make sure that this doesn't happen. And so I get that there's disagreement on should we handle this actively, or should we instead try and support a physiological third stage. And I think Rachel Reed has a good article on that if you're interested in it. But what I'm saying is that we may have a few emergency situations where, yes, people really do need to move fast. And then there's also an opportunity to debrief after. Did we do anything to cause this? Again, like with the baby who is crashing. Did we do anything to cause this? Perhaps a mom who was medicated and in a poor position where the baby wasn't able, or we're causing tectonic contractions where the uterus is just not able to function because the drug-induced contractions are just, they're causing the uterus to go haywire, and the baby cannot tolerate that. Nor can the uterus, actually. So debriefing in those situations is always good. And this is another reason why it's good to understand interventions and whether we should consent or not, because we need to understand. Because in some ways, there's a cavalier attitude. And you see this even among midwives who make choices that ultimately mess with the birth process is, well, if this happens, we can just fix it with this. And I think that's interesting, like looking at medications and the side effects of medications. It's like, yes, this medication may cause muscle weakness and faintness, but we'll just give you another medication to counteract it. And then you end up with all these medications. And it's similar with procedures in birth. So like so much in life, there's just so much complexity, even to these situations that are dangerous in the moment. But the reality is they may be dangerous in the moment, which is why you want to go into it with understanding, knowledge, and also prevention, which we're going to talk more about in another podcast episode. But for as many, for each one of those situations where there really is, okay, this is a life or death moment, we have to make a split-second decision. Most situations that come up in pregnancy and birth are not that. And you can say, let's take a moment, let's think, let's try something different. A good question to ask is, what happens if we wait? So what are the risks and benefits of doing this? What are the risks and benefits of doing nothing? What are the risks and benefits of waiting 30 minutes and trying something else, getting up, moving, changing position, that kind of thing? So those are good questions to ask that can help. They can help bridge the gap between we don't feel comfortable doing this and maybe we should do this, is at least giving it some time. And often, moms will, if they're tired in birth or something, they'll get to a point where they decide that they want to accept intervention. And I don't think that's a bad thing for every mom. I mean, we have these technologies because sometimes they do help. But I think that when you've got well-nourished, well-informed women, often birth goes very smoothly. And also I will say, because like I said in the last podcast episode, there's a lot of mental, emotional, spiritual preparation that goes into it. So I think when we're looking at all of this, those are all important things to look at. But sometimes something may still happen. And so understanding that we can take time, that we can wait, that we can consider, can help you have a sense of peace that if intervention really was needed, I wasn't rushed into it, I wasn't bullied into it, I wasn't pushed into it. I was given the time and space to have it really made clear to me that this was the best option for my baby and I. So asking to wait can be really, really helpful. And then I want you to listen to the episode with Hannah, because just hearing her tone of voice is so wonderful. But I love the way that she talks about refusing something. She was not combative or hostile at all. Instead, she's just kind of like, no, I don't think we're going to do that. Or, nope, we're not going to do that. And it's just this, very firm, very assured, but also very calm. And I think that's probably one of the things that helped her get a lot of respect in the hospital and built her confidence, because she went on to have babies out of the hospital and unassisted and everything like that. So anyways, it helped build her confidence. But I just love her willingness to be on the podcast and to share that. And I think that'll really benefit you if you're wanting to be able to do some role playing or some pretend for situations. And she talks about doing it for prenatal stuff, and she also talks about doing it in the hospital. So that's really helpful. I did want to revisit again human rights in childbirth, because I think it's so important. But Human Rights in Childbirth and the Respectful Maternity Care Charter talks about freedom from discrimination, freedom from coercion, freedom from abuse, right to privacy, confidentiality, and informed choice, and also respect for the birthing mom's comfort, dignity, and cultural values. So all of that is stuff that needs to be respected. So advocate for yourself. Another good tool, remember I talked to you a few minutes ago about going through every procedure or every prenatal test, and just really diving into that, talking about that, using that to open a dialogue with your care provider. Another good tool for that is your birth plan. I do have a birth plan kit where you can download a template and worksheets that will help you create your birth plan. It's got videos that walk you through it. And on that, I give you every choice that you should consider listed out. If you want someone to walk you through that step by step, I can actually help you do that. I offer small packages that are like one-off packages to work on that. And I also we could work on that in the context of a longer pregnancy coaching package. But the birth plan templates are free to download if you want to go through them and kind of DIY them. And the birth plan will really help you dialogue with your care provider as well. Because once you go through all these options, you've developed some information and some knowledge. And then you can open that dialogue with your care provider. I think you want to have your birth plan done by 36 weeks. But I think ideally, if you can work on it before then, to be able to start opening that dialogue, it's good. And tell your care provider what feels important to you and listen to and watch their responses and get that feedback and have that dialogue. Because even if you don't completely agree, I've had many women whose care providers have said things like, for example, they don't want to have an IV, they don't want to have vaginal exams, they don't want to have continuous fetal monitoring. Their care providers will say, I would prefer you did this, but we can probably work with this. And that is the start of a dialogue. And again, remember, you always have the right to refuse consent. Even if they tell you have to have it done, like fetal monitoring or that kind of thing, you can refuse to consent to that, because if they coerce you into it or force you into it, there's no consent. If there's no right to say no, it is impossible to legally consent in a situation where they're telling you you don't have the right to refuse. But again, oftentimes you'll start to learn that back and forth and that sort of thing. And sometimes women will make concessions. I have that happen with hospital birth clients, but you don't have to. And overall, just the experience of dialoguing with your care provider will really help you to feel more confident in yourself and your ability to advocate. And then also having your partner with you, having your doula with you, texting with me or calling me before or after the appointment, any of those sorts of things can help you with building those self-advocacy skills and learning the lingo and becoming more eloquent. Sometimes having support can really help. So I hope that this episode has been helpful, just learning about your rights in childbirth and your rights as a human being. And with any sort of medical procedure, this is not just in childbirth, but especially there, and also looking at some of the unique rights of women in childbirth. And remember, everything that I'm talking about, even though I listed case precedent in the United States, is pretty much worldwide. So these are all good things to think about, and definitely ways to practice and prepare as you are working on advocating for yourself and growing your confidence with advocating for yourself. Yeah, so let's see. Next week we are talking about... next week is when we are going to talk about early detection and prevention. That's what I thought. So I think, again, doing a deep dive into that topic is going to be helpful for you. So definitely tune into that. I hope you have a blessed week, and I will talk to you next week.